Good morning. My name is Whitney Lee, and I will be talking to you about opioid abuse in America. By the end of this presentation, the learner will know what opioids are, signs and symptoms of opioid abuse, the impact of opioids on the healthcare industry, and ways to combat this threat to health. What are opioids? Opioids are medications or narcotics, as we call them, that depress the activity of the central nervous system. These drugs are pain reducing and sleep inducing. What drugs are considered opioids? Codeine, fentanyl, dilaudid or hydromorphone, morphine, demerol or meperidine, oxycodone or oxycontin are all considered opioids. Why are opioids prescribed? Well, they are prescribed to help combat pain from major surgeries, chronic pain. They are prescribed for relief of cough, systemic or spinal anesthesia. People who have diseases like sickle cell often have to take narcotics, pain medicine to help decrease that pain that they have. Opioid abuse. Opioid abuse causes psychological and physical dependence on opioids. It's caused by prolonged use, and addiction occurs when dependence interferes with daily living. Well, what are the signs and symptoms of opioid abuse? There are lots of signs and symptoms, but they can be subtle depending on if the person just started abusing opioids or if they've been abusing opioids for a very long time. So it goes from craving or sweating, needle marks in the arms, constricted pupils, withdrawal from social activities, sudden dramatic mood swings, impulsive actions, engaging in risky activities, and visiting multiple doctors to get more medicines. What they're looking for when they abuse these drugs, though, is the euphoria that it causes. Opioid addiction in healthcare workers. Lots of healthcare workers abuse drugs, narcotics, opioids for several reasons. It accounts for one of the highest rates of addiction in the workforce. They're looking for a way to stay alert, escape from pain or something mental or things that are going on at home. And it's easy access for healthcare workers to get medicines because obviously they work with them every day. We work in hospitals where they're just right here where you can get them. It's ways to get around narcotic counts and things like that, so it's easy access to them. Recognizing opioid addiction with medical professionals. We are professionals, so it's easy for us to cover up something or hide it. But if you notice job hopping, going from one job to the next, falling asleep on the job or in between shifts, volunteering to administer narcotics, frequent unexplained absences, incomplete charting, unusually friendly with those doctors that they know prescribe those drugs freely. Let's talk about some facts about opioids. In 2017, more than 191 million prescriptions were written for opioids. That's a lot. More than 750,000 people have died since 1999 due to opioid overdose. Wow. In 2018, 41 people died each day from overdoses involving prescription opioids. How do we combat opioid abuse? Well, we improve the prescribing of opioids. We treat existing opioid abuse. We reverse the effects of opioids. And we educate. Simple education. Where I live and what we do at my organization for opioid abuse is we have discontinued the use of demerol in the ER. A lot of people were coming in to just get that quick fix. Oh, I'm hurting, I'm having a little back pain. I was just in a car accident. Can I get some demerol? Can I get something to ease the pain? And they were coming in every weekend, every day. So we stopped this. We use a 1, 2, 3 step method of prescribing pain medication. We try the least effective method of pain management first, and then we go up the tier. Accurately and appropriately assessing pain levels. Pain is subjective. Nobody feels it but you. So you are the only one that can tell me how much pain you're in. Clear and early identification and type of drug abuse. And provide resources and community support for addiction and abuse. How the CDC is helping the opioid epidemic. They monitor trends, they support providers, healthcare system, and payers, and they are increasing public awareness. Making a difference. You are not alone. Be there for the person that you think or that you know is abusing drugs. Be a role model. Be flexible. And most importantly, show empathy. Thank you so much for your time.